Thank you for inviting me to be on Ameyaw TV. Hopefully we'll get a chance to talk about things that are of interest to people in Ghana in particular and West African sub-region concerning cosmetic surgery, how it's done, who is the good candidate, what are the risks, what are the opportunities, and what are the standards, so that people will be better informed about how to make that decision to enhance beauty. My background in terms of schooling was high school, with the mobile boys, Kwasi, that's our claim to fame. And I did Mfantsipim school, and then I went to KNUST for medical school, and then I did Howard University Hospital in Washington, D.C. for my residency, and I did internal medicine, obstetrics and gynecology. And then afterwards, I also did Master of Business Administration at the College of William and Mary in Virginia. And, that actually helped and enhanced my decision-making in terms of business to be able to take the business to the next level. So after finishing Howard University, I did work as obstetrician gynecology, delivering about 300 babies a day. I was based in Richmond, Virginia, and it was very exciting times, doing deliveries and taking care of women, pregnant women, and delivering their babies and all types of deliveries. And then following that, I did additional training in cosmetic surgery to allow me to be able to really take care of women after they've finished having kids. And this area we call the Mummy Makeover. So essentially, when women have finished their childbearing, the toll that is on their body because of pregnancy and childcare and all that, it makes their bodies look different. So a lot of them would want fat redistribution. That's really the number one thing, because they gain weight in their midsection and their body shape becomes, instead of the ideal, they call them hourglass figures, they become closer to a beer bottle, for lack of a better word, but they want to get their hourglass shape back. So that is, essentially what I do now to help women get their shape back. And it includes taking fat from one area of their body, particularly the midsection, and putting the same fat back on their hips and their behind, and creating a narrow, cinched waist. That way, their clothes fit them better, they're back to their youthful self. And sometimes we also add another procedure called tummy tuck, because they may have loose skin that they can't get rid of because of the pregnancy, and we reduce the loose skin by performing what we call the tummy tuck. In addition, some women want their breasts to be more perky, and we can do a breast lift, breast reduction. We can even put implants, and the implants could be fat itself, sometimes it's saline, sometimes it's silicone, and these are all very, very safe procedures. Over the last, I would say, 8 to 10 years, I've been coming to Ghana. Initially it was probably maybe once or twice a year to get a feel for the market and to get a feel for the needs of the clientele. And as time went on, recognized that most people were interested in surgical procedures. And the number one procedure that people are interested in is the fat transfer to their buttocks to get bigger hips and bigger buttocks, the projection, and to narrow the waist. And also, people want to lift their breasts. Now, aside of that, these are called surgical procedures. That is, we make small incisions or big incisions, we bring them to the theater like this and perform the procedures. There are other procedures that I perform that's called the non-surgical. The non-surgical procedures involve just putting in, injecting, using needles to inject what we call fillers. Fillers, they're like gels, and there are different types of gels. There's hyaluronic acid, there's Radius, there is Sculptra. These are all brand names. And we use the fillers to take care of areas, especially in the face, that have lost fat. And sometimes, instead of putting fat in those areas, we put the gel to lift up the mid-face to make the face look more youthful. Then again, we also have other things called Botox. Botox is, in the medical term, is called a neurotoxin. And what it does, it comes as a liquid. And we use very tiny needles and small syringes, and we determine the amounts of Botox that we have to inject to the areas, usually the forehead, we use that to sometimes even lift the eyebrows for the women so that they have, prettier looking faces. And what it does is that we inject the Botox into the muscles. And when the muscles relax, it takes care of frown lines in the face. And there are certain areas of the face that are controlled by 2 different or 3 different types of muscles. And when we inject Botox in one group of muscles, it relaxes those group of muscles so that the other muscles take over and pull the face in another direction. And this does not involve surgery. So we also have skincare products. And we go really for the basics. Every man or woman in Ghana or in this sub-region needs sun protection because of the intensity of the sun. So we have skincare products that have some sunscreen, sun protection, and moisturizer at the same time. That's really the first thing. But what most people need on a daily or weekly basis is something to cleanse their face of the oils that the skin produces. The next thing is they need something to exfoliate, or that is remove the dead cells that their skin is producing on a daily and weekly basis. And then they need something, a product to hydrate or bring moisture or give strength to the skin. Then, depending on what type of skin they have or what kind of condition their skin is, they may need some vitamins to nourish their skin. So we have some vitamin A, vitamin B, vitamin C that are products that patients really need to enhance and improve their skin texture and quality and make them continue to look young. And in a nutshell, this is really the beginning of the fountain of youth that people strive for, and they have to be careful what they purchase. They have to read the label and also be careful the source of the products that they're using, because some of these things are not regulated. So, people just buy anything. In terms of skincare, one of the biggest problems that I come across is stretch marks number one. And number two is very dark areas around their cheeks. A lot of women are using products, and a lot of these products, they have officially been banned in Ghana, but they're using products that have some steroids and some bleaching agents that really cause damage. And this damage is very irreversible. And so it is good, I would advise ladies to be proud of their skin color. Well, I just wanted to clarify the difference between plastic surgery and cosmetic surgery. Plastic surgery is considered the area of medicine where people go to see the plastic surgeon because they have a condition that has caused some part of their body not to be normal again. For instance, they have, say, a cancer. That's a rare form. Cancer on their body, and the cancer destroys their breast, and they need breast reconstruction. That is plastic surgery. Or they have a dog bite, or they have a motor vehicle accident, and they have a lot of laceration or injuries that needs to be corrected. That's still plastic surgery. Cosmetic surgery essentially is to enhance beauty. And enhancing beauty, it also allows the woman to build more self-confidence. And you should see some of my patients who, after they've had, we call it lipo 360, where we cinch their waist for them and we transfer the fat that we get from cinching their waist to their hips, and now they walk with a swag. They walk very different. They feel more confident. Their step is different, and it's all because they've enhanced the beauty for them. Now, in terms of who is qualified, these procedures are elective. That is, there's no emergency, and people will come in when they can afford the procedures. And it's a matter of choice. And so when people come in now, the real criteria that I use to determine who I will consider for any of these procedures has to be, number one, a medical issue. If they have a medical problem that has not been controlled, diabetes, high blood pressure, maybe some type of sickle cell disease, or, they just had a baby, for instance, and they're still in the postpartum breastfeeding, I wouldn't consider them. So the medical condition is typically the first criterion I use to determine, look, who is qualified and who is not qualified. Then the age also is another factor. If you're too young, we wouldn't consider you. 18 or below, I wouldn't consider it. And if you're too old, sometimes you have more risks, of undergoing some of these procedures. So we try to eliminate those. And there's certain people who may just be morbidly obese. That is, there's so much fat that they actually will need to lose weight before they can be considered for cosmetic surgery. So in the big scheme of things, those are the three major categories of people that, I say, no, this is a no-no. I also have heard about the news regarding the bad outcome from cosmetic surgery in Ghana. Unfortunately, the regulatory bodies are making significant efforts to protect citizens. But I also have noticed that sometimes there's not enough funding to really police facilities that have been closed, because sometimes the inspectors will go there and they may be paid on the side and they don't come back. But it is important that the average consumer understands that this life is just one life. You know, I mean, there's really no turning back, and it's a very delicate situation. So it is very important to check the background of the physician, to also find out their qualifications, to also find out about their experience, to talk to friends and colleagues. And during the interview, you should go in prepared with information that you can obtain on the internet about these procedures, or even on YouTube about these procedures and how they are performed, so that you can ask specific questions be able to obtain the answers that make you comfortable. There, you know, in the US, there is a site called realself.com, that people go and ask a lot of questions. They post a lot of information. So one can actually go to those sites and just educate yourself. That is the first thing you need to do, to educate yourself about the procedure before you see the doctor. And when you look at the doctor's before and after pictures, you have to pay attention to make sure that the before pictures and the after pictures really go together. Because there's sometimes people will Photoshop when they're starting, when they haven't done certain procedures before. People will use pictures that don't match, and those are telltale signs about these things. And unfortunately, when patients have bad outcomes, as for death, most times we hear about them, but when they have bad outcomes in terms of problems, you generally don't hear people talking about them, because for one reason or other, they may not have told a lot of people before they went in for the procedure. So when they have a bad outcome, they feel shy or they feel guilty to tell people about them. But it's important to talk to somebody who has actually been to the doctor, at least one or two people or more if you can, to be able to be comfortable, as to what procedure that you're going in for. And, just based on that, you should be able to make decisions. And the final thing really is, I believe a lot of people just focus on price. That is, they want to get it from the cheapest source. And remember that for all the products that are produced in the world for consumers, there are different grades, different stuff that people buy from different places. And, and if you don't buy the right products, you may not get the great results. So in summary, check on the doctor, check on the references, and do your homework. And go and have a consultation and ask all the questions that you need to ask, and be comfortable. And sometimes it may be good to go with a friend, or your husband, or your brother or sister, anybody, so that they can be a second ear, as to what is going on, and they can help you make the right decision. There's not just one, the areas involving non-surgical, that is using fillers to enhance people's face, taking away of the aging appearance. I really enjoy those areas. So I use Botox and fillers. I combine them and able to enhance people's features and make them look more beautiful. To me, the most important thing is when the patient is happy. Because the first thing I do when patients come to me is I listen to them. If they want to enhance their body with fat transfer, I say, go and find me a picture, your wish list, your ideal picture, and let's talk about it. Because it's not one size fits all. And people generally, in their mind's eye, have an idea of what they want to look like. And if it is possible, I tell them that this is possible. And if it's not possible, I say, no, this is not possible. You know, there's one woman patient that really comes to mind. She came in and we really turned her life around. You know, with we did a liposuction and fat transfer and a tummy tuck. And I tell you, when this was 6 months down the road, she came back and I didn't even recognize her. She was looking totally transformed, and she was beaming with smile from grin from ear to ear, and you know, so those are the things that really make me happy, you know. But you know, at the end of the day, like I said, I listen to the patient and I make every effort to give them what they want. And there are people that I've turned down because I said, this is not possible, you know. And I'm also happy with that. That it's not every case that I will take on, but when I take a case, I'm really dedicated, I'm very passionate, and I go ahead and I deliver for my patient. When I started coming to Ghana, I wasn't sure how the market was. I had done some research and recognized that West Africa really lacked medical tourism. And cosmetic surgery really becomes the center or the nidus of any medical tourism that any part of the world is trying to establish. And so the future for Ghana and its impact on West Africa, you know, the way I see starts with the beautiful airport, Terminal 3, that has just been open. Is really going to attract a lot of visitors coming to Ghana. And we're looking forward to having a complete medical tourism hospital, and not just cosmetic surgery, but to have a lot of different specialists to perform procedures that they cannot receive in their own countries in West Africa. So I'm hoping and praying that within the next couple of years, you know, we will be talking again on Ameyaw TV about the progress we have made and how we're able to bring cosmetic surgery and make it affordable for people who are sitting on the fence and they cannot afford at the moment. Thank you very much for your time.